Hello, everyone, and welcome to the Adventures in Brain Injury podcast. My name is Kevin Ballister. I'm a severe traumatic brain injury survivor, creator of adventuresinbraininjury.com and feedabrain.com, and author of How to Feed a Brain, Nutrition for Optimal Brain Function and Repair. With me is my magnificent co-host, Michelle Malmberg.
Oh, you are so kind with your words. Hello, Kevin.
How's it going, Michelle?
All the better for hearing you online again.
So this episode is brought to you by Revive Treatment Centers in Denver, Colorado. Revive is a multidisciplinary neurorehabilitation clinic that specializes in traumatic brain injury and concussion, as well as neurodegenerative diseases, infectious diseases, and autoimmunity, especially neurological autoimmune.
And they are helping get you to the point where you can give so much. So
Yeah.
Thank you to everyone at Revive. Mm-hmm.
I'm actually heading over in that direction real soon. So
Wow.
I'm excited about that.
Yeah, your home turf and home of your brain center rehab clinic. So that's great.
Yeah.
Just a little excited.
Mm-hmm. A little excited.
Well, this all on the heels of your most recent feedabrain.com interview series. A phenomenal event. Thank you for hosting. Well done.
Thank you so much. That meant the world to me.
Oh, yeah. That was the culmination of, well, everything since your injury. That was really the culmination.
Yeah, well, that was to celebrate the release of my upcoming book,
Mm-hmm.
How to Feed a Brain. And so yeah, and I think that plus my book are the culmination. They set the stage for what's about to happen. You know, it's been my mission to improve the standard model of neurorehabilitation and brain optimization, because what we do to heal a broken brain is what we do to optimize performance of a functioning brain. You know,
Yes.
we are supporting brain function, period.
Mm-hmm. Well, I think that is also supported by the words and research of Dr. Dan Engel, who spoke in an interview on your Feed a Brain interview series.
Yes, absolutely.
Yeah. So it's all coming together, these professional opinions, the research, your book. It's well done. You rocked it.
Thank you. And yeah, if you guys missed it, like, you shouldn't have missed it. But
Hey, life happens.
Life totally happens. But what I want to do is, for my audience, I created a VIP link where you can watch a few of the interviews. We made a few of them available for you to watch. And then I'm giving you guys this amazing deal. So what I'm doing is you can get the interviews in both video and audio format. And they're enhanced interviews, meaning that I included slides to help to drive some of the concepts home. So you get the interviews, you get the slides that go with the interviews, you get the transcripts of the interviews, which is super helpful when you're like, I know that information was in one of these interviews, in this interview or whatever, and you're not going to go scrubbing through the video to try to find it. You can use the search function on the transcripts and find exactly what was said and pull that up.
And take it to your physician.
There you go. Plus 12 handouts, charts and handouts that you can take to the grocery store. They're just super helpful. They go with the book.
I use them for my lectures. They're great handouts. Thank you.
And, absolutely. And you can get all of that for $49. Just go over to feedabrain.com/VIP for that deal.
You've received so much support from people in the functional medicine community, in the functional neurology community. In fact, Dr. Mark Hyman gave you a fabulous, threw you a fabulous bouquet in his comments. I'm going to read them right now. This quote: nutrition is fundamental to our brain health. Time after time, the research and clinical outcomes prove that our dietary choices have a profound effect on our function. In How to Feed a Brain, Kevin uses his own personal experience as an example and creates an easy-to-implement roadmap of nutritional changes to support your brain function and repair. The concepts he discusses are supported by a growing body of research evidence. This book is a welcome tool for people with neurological conditions and anyone who wants to optimize their brain performance. Hear, hear.
Wow.
Well done. Yeah.
And that guy's 10 times New York Times. 10
yes.
times.
Yeah, 10 times, yes.
Ooh.
And he is the chairman of the Institute for Functional Medicine, where I enjoy studying. And he's also the director of the Cleveland Clinic Center for Functional Medicine and his own clinic in Massachusetts. I mean, it's... he's a busy man. He's seen a lot, knows a lot. So, you know, it's those words mean a lot.
Mm-hmm.
Yeah.
Mm-hmm.
So you've received a lot of support, and, you know, we can continue to help more people who are in crisis situations or unfortunate chronic situations with neurological conditions with the help from our listeners, from our audience. And there are a couple of ways people can do that. Kevin, how can our listeners support us?
Yeah, thank you. If you want to be a sponsor, either pre-roll or post-roll, or if you want to be a supporter of us through just throwing us a buck or two for every episode we do. Mm-hmm. So go to feedabrain.com or adventuresinbraininjury.com/support. And there are several different options of how you can do that. Patreon is what I was talking about with our virtual tip jar, essentially.
Yes.
And then if you're someone that we want as a sponsor, let's figure something out.
Yeah. It's great to join hands and come together to bring this information to so many other people, so many other families. We've got medical professionals in our listening audience, which is phenomenal because they're going to change healthcare for all of the patients in their practice, in their clinic. And imagine this groundswell.
That's what we call exponential influence. Influencing influencers so they can influence other influencers. Yeah.
I love it. I can't wait to see the effects of it. And speaking of effects, we have an amazing guest today, Dr. Kat Toups, and she is doing some fabulous research outside of and within her own clinical practice. It's in the spring of 2016, I mentioned to you the impressive contributions of an holistic psychiatrist from California, who over the past couple of years would take the time to provide very thoughtful and thorough input to questions on two forums, the Functional Medicine Practitioners Forum and the Functional Neurology Seminars Forum. And she would support other practitioners no matter if they were novice or more experienced. And then I noticed she had registered for the Dr. Karazian 6-week brain rescue plan. Why would an amazingly accomplished MD join a course with over 1,000 of us patients with neuro issues? I really appreciated how she was willing to show up and learn alongside of us. 3 is my magic number, and I decided I had to someday meet this intriguing woman who was unknowingly mentoring me through the cyberspace classroom. So I reached out and asked if she would share her wisdom with our podcast audience, and here we are. Dr. Kat Toups, MD, is a distinguished fellow of the American Psychiatric Association, which is, by the way, the highest honor bestowed by the APA. She is board certified by the American Board of Psychiatry and Neurology, and previously boarded in Geriatric Psychiatry. 3 board certifications, Kevin. That's a lot of studying and clinical hours needed before applying to sit for those board exams. She is also a certified practitioner with the Institute for Functional Medicine, which, Kevin, is going far beyond the medical textbooks to look for root causes of illness. Dr. Toups was formerly an assistant professor of psychiatry at the University of California at Davis, where she was the inpatient residency training director, and later the founder and medical director of Bay Area Research Institute, that tenure was 12 years. After serving as the principal investigator on over 100 clinical trials, including 20 failed trials for Alzheimer's drugs, she realized that the elusive cure for brain and psychiatric illness was not going to be found in a pill. So in 2009, Dr. Toups attended a food as medicine conference that opened her eyes to the power of nutritional interventions. And she learned about functional medicine, a paradigm that could help patients really get well by working to uncover and correct the root causes of their illness. She went on to complete all of the advanced training for certification at IFM and scores of other functional and environmental medicine training. I've underscored that because that is important. I'm going to ask. Her practice is now devoted exclusively to functional medicine psychiatry and functional approaches for treating cognitive impairment, dementia, and neurodegenerative disorders. Dr. Toups was a contributing author to the academic textbook, Integrative Therapies for Depression, Redefining Models for Assessment, Treatment, and Prevention, which was published in 2015. And she has appeared in several functional medicine and dementia online summits. I am so tickled that she has found the time to be here with us. In addition to her busy functional medicine practice, Dr. Toups is currently working with Dr. Dale Bredesen, who is the author of the acclaimed book, The End of Alzheimer's. And the two of them are working on developing a prospective clinical trial using a functional medicine method to reverse mild cognitive impairment and early dementia. Oh, this is going to help so many people.
Wow.
Yeah.
Wow. Amazing. So good to have you here, Kat.
Welcome, Kat. Thank you.
Well, thank you. I'm so excited to be here. Maybe said it all, Michelle.
No.
That was, I'm sure that's not even close. We haven't even gotten started.
No, I haven't.
I'm so impressed. I love how you brought up, how you talked about dementia. And before we got on the call, we talked about how dementia and neurodegenerative diseases and brain injury, the treatment is often very similar.
Right.
Could you talk about that a little bit?
Sure. Well, I've really come to conceptualize anything traumatic as the brain will sort of fit in as a traumatic brain injury. So when I work with people with psychiatric disorders, rather than thinking of it as a neurotransmitter deficiency, I think of it as inflammation in the brain. So something inflammatory is happening that's affecting how that brain works, how it works metabolically, how it works energetically. And so instead of thinking that, okay, this is just a deficiency of serotonin and we need to give a medication for that, instead I look to the body and what's happening in the body that's affecting that inflammation in the brain. And when we have inflammation in the brain, it wreaks havoc, anywhere that's happening. And when you conceptualize that as a traumatic brain injury, traumatic brain injury is generally thought of somebody having an acute injury or maybe a repetitive injury, like some of the sports TBIs.
Right.
Is causing damage to the tissues in the brain. And when you have damage, then generally, everything is interconnected in the brain. So if you have damage in one part, it eventually starts spreading out to other parts. So TBI is a neurodegenerative disorder. For most people, the injury doesn't stay confined to one area of the brain. And so you may see things, progress over time. With dementia, we've really shifted our thinking in dementia. Alzheimer's disease it's considered by many people to just be this mysterious, untreatable brain disorder. So you might have the genes and you develop Alzheimer's and your brain degenerates and no one knows why and no one can stop it. But really what we know now is that Alzheimer's and any kind of dementia is generally, it's a reversible disorder. It's a multi-system disorder, and it occurs due to toxins and infections and inflammation and lack of hormones and poor nutritional support. And it has a strong autoimmune component as well. Some exciting new stuff that we're
Wow.
learning right
Wow.
now.
Ooh.
So yeah, the bottom line is to really look at everything as a system and look at all of the factors that are affecting the brain. And when we put all those things in balance, then people can start to heal. And so I think of that as the same way with traumatic brain injury. When you dial in all the factors that can support the brain, the hormones, the nutrition, the sleep, the exercise, so many things that can help support the brain, then the brain can start to heal. And then, of course, on top of that, we now have an expanding science of neuroplasticity, so many different ways that we're learning that we can stimulate the brain for rehab and to keep making new neurons and new connections.
Yes.
So maybe we can't undo the area of damage, but we can work around it. And when I went to medical school in the 80s, we were taught that when you were 18, you had your maximum number of neurons or brain cells, and that was it. It was downhill from there, and life was over. But, now we know people can make new synaptic connections in their brain even up to the point of death. They've put people in scanners that are dying, and they've given them new learning tasks, and they literally can image the brain making new synaptic connections. So that's the most exciting thing, that all of these kind of brain disorders are reversible, and that if we can find the factors that are causing them. So in the case of a traumatic brain injury, often it was a discrete injury, but with other situations like dementias and neurodegenerative disorders, it's due to multiple things. And even with the head injuries, I believe Michelle and I talked about this earlier, I think that some people have a minor head injury, but they go into a major tailspin. If people are out of balance and their nutrition is poor, they're under a lot of stress, so maybe their gut is leaky and they're reacting to everything, and there's a high level of inflammation in the body, and nutrients are deficient, and the system is just not metabolically strong. A very minor injury. I've seen people have, a little rear end injury and a little neck trauma, and then go into a tailspin. So it just becomes the straw that broke the camel's back, that somebody's holding on the ledge by their fingernails, hanging off the ledge, but they're hanging on, and then one little thing disrupts the whole system.
And Kat, what does a tailspin look like in your clinic, your patient population?
Well, a tailspin is just when everything is falling apart, when people are overwhelmed, when they can't function, they might not be able to sleep, they're anxious, their brain isn't working. And then on top of that, of course, comes in all of the physical side of the injuries. So with most non-TBI brain situations that I treat, things are out of whack in the body. So I always say, if you want to fix your brain not working, you have to start with your body.
Yes.
I absolutely just was talking with somebody about my experience and what I did to recover my brain.
Right.
And I was like, I realized inflammation anywhere in the body is able to inflame the brain.
Yeah.
And I need to get my digestion right. I need to remove the toxins. I need to start detoxing, and then I needed to introduce the right nutrients. But yeah, it was like, all right, if I'm going to get my brain healthy, it looks like I need to get everything healthy.
Well,
okay.
Yeah.
I'm ready for it. Here we go. I'm gonna get really good at getting everything healthy, because that's what I have to do.
That's exactly the case. I always tell my patients, we need to look under every rock. We need to turn over every rock and look under it and say, is this one of the problems? Is this one of the problems? So in order to get people really well, you need to look at everything as quickly as you can.
Yes, isn't that the truth? Now you have a soft spot for patients recovering from dementia, because you have a demented story as well.
Yeah, let me speak about that for a moment. You said got a couple emails passing forth, and then I saw one that said my dementia story, and I'm like, whoa. And it started off at age 51, I became demented. And I was like, whoa, okay.
Yes. So,
I'm going to let you tell that story because I didn't have time to read it.
So yes, it's definitely near and dear to my heart. Having had dementia, I especially don't want anybody to be where I was. And when I work with people with dementia, I want them to be better yesterday, as quickly as possible. And the exciting thing is, from having been on my own path, I've learned tools to help other people much more quickly than I could when I was trying to figure it out myself. So yes, when I was 51, I became demented. Not in the metaphorical sense, but literally demented. I was losing my memory and I was losing my mind. At that time, I was doing the clinical trials that we mentioned, and I had been the principal investigator on 20 trials for Alzheimer's, as you mentioned, Michelle. And while I was doing those trials, I started to realize I was as cognitively impaired as my patients.
Wow.
And I had developed chemical sensitivity, so I became allergic to everything. I was covered in rashes and hives. I was up all night putting on lotion because I was so itchy. And with all that inflammation, I had severe chronic fatigue. I really couldn't, by the time I stopped working, I couldn't get out of a chair for a year. But the worst part was all of that inflammation that was ravaging my body was eating up my brain. I would do cognitive testing with my Alzheimer patients, and I would give them 3 words to remember for the mini mental status exam.
Yes.
I had to write down which set of words I was using. I had 2 sets that I alternated with, and I had used those words for more than 20 years, and I could not remember which one to ask my patients the question. I would get confused dialing the phone numbers. I would have to start over dialing phone numbers, sometimes even more than once. I forgot how to do things on a computer, and that was really frustrating for my husband. I would ask him over and over to show me things, and he would say, well, I just showed you that, and I couldn't remember that he showed me that. It got worse. I had trouble with my driving. I literally lost the ability to back up or parallel park. They were too complicated. The sequencing, I could not sequence to get those things done. And one day my husband got in the car with me and I was driving and he said, Kat, what's wrong with you? You're like a little old lady. And I said, I don't know, Dorian. So many things are happening when you're driving. And basically my processing speed had become so impaired that I just couldn't integrate all of the inputs happening with driving. And I was a good driver before, and I'm a good driver now, but it was definitely a problem at that point. I developed auditory processing problems. I couldn't understand what was being said. And I kept going to the ENT and asking for hearing aids. And they would test me and say, well, you just have a mild hearing loss. But one day I went back and he looked at me funny and he said, the problem isn't in your ear, it's in your brain.
Wow.
And so I had
Perfect.
I lost the ability to decode words. If there was any background noise, I don't normally watch TV, but if I walked in and the TV was on, I couldn't understand what they were saying. I would just hear mumble, mumble, mumble. And oh, my heart goes out to children that are born with that and grow up with that, because it's a terribly frustrating problem to try so hard to understand what someone's saying and you're just getting snatches of the words.
Yes, yes. Wait, Kat, amid all of these frustrations, you've called them frustrations, but was there any fear building for you?
People ask me that, and I think I was just living in such overwhelm, trying to maintain functioning and keep moving and putting one foot in front of the other and, not give up to the impulse to just lay in bed and be a sick person.
Right.
That perhaps the fear came later. I was just in some kind of, I almost want
fog.
to say mindless.
I was thinking about how I can relate with that a bit, where it's like when your brain is having trouble, you have trouble feeling how you're feeling. Like it's like I say, you can't tell that you're in a brain fog when you're in a brain fog because you're in a brain fog,
Yes.
How can you tell it's raining when you're underwater? Basically.
I think that's really really profound. And I think that as I did start healing and then notice certain things that would provoke the brain fog, like eating something that caused the bloating that clearly then led to the brain fog, once you no longer have it all the time, you can start to see those patterns. But that's a really profound statement. The brain fog when you're in the brain fog.
Thank you.
It's true.
You know, a lot of people think that that's just a normal process of getting older. And while it's common, I don't think that's normal, is it?
It's absolutely not normal. So I was in my early 50s, and when I treat patients with dementia in their early 50s, it goes very rapidly. So it's quite different than what we think of as the late onset dementia. And it kind of takes us back to the issue that there's different reasons and different causes that people get dementia. And so our job as clinicians becomes to look at all of those factors so you can help people heal.
Okay, let's get into those factors, please.
Yes. Well, so the first place that in functional medicine that we look is the diet and the gut.
Yes.
So there's no way that anybody can heal if they're eating a crappy diet. Eating inflammatory foods with no nutrition, you're not going to provide the fuel that your body needs to run. And when people have a serious illness or degenerative disorder or head trauma, the body just gets under siege. And so we have to try to treat it even more kindly than normal. So we start with the food. Of course, what are people eating, and help people to eat a whole foods diet and, get rid of the processed food, get rid of the sugar. There's so much data with the impact of grains on the brain. And so for my dementia patients, I personally prefer that all my patients stop gluten, because we know the inflammatory nature of gluten, and we know that it destroys the lining of the gut, that it elevates the zonulin, that breaks up our tight junctions in our gut and causes leaky gut. And that leaky gut turns out to be a huge factor for the leaky brain. So when our gut is not intact, and the leaky gut, I suspect you've covered it before, but it's just what it sounds like, little microscopic holes in the lining of the gut, allows food particles in our gut to get absorbed into our bloodstream. It allows bacteria that come in with our food and viruses to get absorbed into our bloodstream. And then when things get in the bloodstream, that turns on our immune system.
Yes.
So blood should be sterile, and if this stuff is getting in there, it calls out the troops and all of our white blood cells and our natural killer cells, and it says, okay, let's kill these invaders. And so the way those invaders get killed is that our immune cells release inflammatory chemicals called cytokines. And those inflammatory cytokines don't just stay near the site of where they were absorbed, right? Our blood circulates all over our body, and it circulates through our brain as well. So when there's inflammation, it also destroys the lining of the brain. The blood-brain barrier that's supposed to protect the brain from things coming in also becomes leaky. So we say leaky gut equals leaky brain. It's inevitable. If your gut is aimed and not working, it's going to be affecting your brain. And I see that all the time for people that come in with any kind of GI disorders. And we know that stress alone can disrupt the lining of your gut. People have studied college students at finals time, and they can see that the markers of leaky gut elevate during finals. So stress becomes a very important thing. And of course, when you're dealing with an illness like I was, like both of you have, you're not functioning, your stress goes through the roof.
Yes.
So, it becomes a dual thing, working with the body and working with how can we help people with their stress and their response to that. But when those inflammatory cytokines get turned on in the brain, the microglia in there, when they get activated, they don't have an off switch.
Right.
Every time they get turned on, they just stay in that killing mode or that inflammatory mode until they die, which is 2 to 3 months. So when I'm working with people on their diet and they say, okay, well, I don't eat much gluten, I only eat it like, once a week or once a month. And I say once a month, that's enough. Those microglia will stay activated in your brain for 2 or 3 months. So you're never letting that inflammation die if you're eating something that's inflammatory. So definitely the food is where to start. And we have more and more data on the effects of grains in general. We know that that gluten grains are the highest in sugar of anything we eat. They contain more sugar than table sugar.
Wow.
But all of the non-gluten grains are still, are carbs, and carbs, I tell my patients, see this equation: carbs equal sugar.
Yes.
They go straight to sugar. And
thank you, doctor. Thank you.
and you'd have to be living under a rock if you didn't know by now that, we have a plethora of data that sugar is harmful for our immune systems and our healing. So, the high carb diet, people are just feeding themselves sugar. And so shifting people's diets into a lower carb, higher fat diet becomes really important for healing the brain. The fats we've known for a long time. We've known the ketogenic diets have been used for many decades for children with intractable seizures. So we know when we shift someone into ketosis, and that means that you restrict your sugar to the point that your body has to burn fat for fuel. So our body can burn sugar for fuel, it can burn fat for fuel.
And that's that type of fuel is a more efficient fuel for the brain, isn't it? That's
right. It's a cleaner fuel. Yes, like the cleaner gasoline, right? The one with the less additives.
Right. Yes.
So somehow, like with the kids with the intractable seizures, shifting to that kind of diet can settle down that overactivity of their nervous system and quiet down their seizures, even when no medications can do it. So,
isn't that beautiful?
Yes, and what we see then with brain injuries is that for some people, getting into ketosis where their body is burning the fats instead of the sugar really heightens their thinking and the clarity of their thinking and their processing. And it can happen very quickly, within days. And of course, people can notice when they get out of it because their brain doesn't think as clearly. Now people are exploring using this kind of diet for people with ADHD, because for ADHD is its own set of brain issues and brain processing issues. So I don't think everyone should do a ketogenic diet. I don't think there's a one-size-fits diet for anything, but that is certainly, minimizing the sugar and the carbs becomes a great first step for people. And then with the fats, we need people the fat is critical because our brain is made of fat. So if you think of all that squishy stuff in the brain, it's fat. That's where cholesterol comes in. So cholesterol turns out to be a healthy fat. It's been maligned, for decades now. And I just read some article with a headline saying this is the biggest medical mistake of the century, the notion that we shouldn't be eating fats.
Right.
And I can tell you, as one of the many factors in my own healing journey, I had to completely change my diet and revamp the fats. I grew up in the low-fat era, and I was a good follower of the dogma. I ate low-fat, and my cholesterol was always 135. And I thought, oh, I'm so good, I'll never get heart disease. Well, what did I get? I got dementia. What would you rather have? So without my cholesterol being high enough, I couldn't support my brain tissue.
And how many millions of people worldwide, but especially in this high carb, high grain consuming society, do we have walking around with injured brains, yet they've got perfect cholesterol scores?
Right. Or even worse, it's iatrogenic because the doctors say, oh, your cholesterol needs to come down. And then they're put on a statin drug. The cholesterol comes down and then they develop dementia. I mean, there's a warning for the statin drugs that they cause cognitive decline. It's quite clear. So
and we talked with Dr. Perlmutter on the interview series, and he brings up that all right, statins raise your blood sugar. High blood sugar is associated with type 2 diabetes. Type 2 diabetes is associated with Alzheimer's disease. So it's like what we take to lower our cholesterol gives us a huge increase in risk of dementia and Alzheimer's.
So it's a double whammy because we're driving the cholesterol down too low to support the brain and the hormones, because the cholesterol turns out to be the precursor of our hormones. So cholesterol turns into all of your sex hormones, your stress hormones, and ultimately your thyroid hormones. So low cholesterol, you're going to disrupt the hormones. And then on top of that, with the statin drug, adding in that diabetes risk, yes, it's a double whammy. And, you know, one of the many factors that's driving our exponential rise of dementia here. So some of the hardest patients I work with psychiatrically and cognitively are with low cholesterol. And not only the main, parenchyma of the brain, all that squishy stuff, but all the neurons have myelin sheaths around them. And those myelin sheaths help to conduct the impulses down the nerves. And those myelin sheaths are made of fat as well. So if we want to support our brains, pouring in the healthy fats, and obviously the more we can get from our food and our diet, is the best place to do it. So I ask my patients to shift to eating lots of healthy fats, and the healthiest and the kind we can break down and assimilate the best would be things like coconut oil, extra virgin olive oil, avocados. So those are the top dogs.
I'm so glad those are on my counter in my cupboard. They're out every day. Well, yeah. And I want to toss into the ring here. Well, it's over a decade ago, Dr. Dwayne Graveling wrote Lipitor, Thief of Memory. And I mean, he was a lauded, very accomplished man, with a former astronaut, aerospace medical research scientist, flight surgeon, family doctor, and he experienced short-term memory loss because he was on a statin drug. And it's terrifying to think how many millions of people are on these prescriptions. And I have to say, I look at family members of mine and I'm concerned because I know they're on them, but I can't say anything.
I know.
Exactly.
So rough.
I have a really nice summary of a study that I show my patients about cholesterol, because it's a hard shift, right? This is the dogma that we've been taught for decades, and it's a hard shift when I look at somebody's cholesterol and go, your cholesterol is 165. That's not high enough to support your brain adequately. And
wow.
And of course their doctors love it. They're cardiologists, but I have a study that was done by the World Health Organization, and it was a meta-analysis of multiple different studies that looked at cholesterol, and they correlated it with morbidity and mortality. And the conclusion of this study, and there was so many that they looked at, I have them all graphed, they're little dots on a graph, so I'm not sure how many, but they concluded that a cholesterol in the range of 200 to 240 had the lowest all-cause mortality. So if your cholesterol is in that range, which the average is 225, is the middle of that range, you're least likely to die from anything. And furthermore,
I was just going to joke that except for the wrath of your one's cardiologist, that might do you in.
Exactly. And then they showed that the lower cholesterols correlated possibly with a higher risk for cardiovascular disease rather than lower. And they definitely correlated with more infectious and parasitic diseases.
Wow.
And from a psychiatric standpoint, I can tell you that they correlate with autism, severe dementia, depression, anxiety, panic attacks. It really makes a difference when we can get people's cholesterol levels up to an adequate level to support their brain.
Unbelievable. And so I'm speaking to you from Canada, and our measurements are slightly different. So in American terms, or this was a WHO study, would you just list the units that 225 ideal number comes from, please?
Yeah, I'll have to pull it up while we're talking and
sure.
See if I can find that.
And so what's it going to take, Dr. Toups, for people, medical professionals, medical schools to start to turn the tide on this and see cholesterol as valuable?
Well, I mean, it is changing, and I think it's changing, from the bottom up. So, us as consumers and people that are concerned about our health can, read and learn about these things. And now with social media and all of the internet availability,
yes,
we're driving the evolution of understanding these things, from a community level so much more rapidly. And I just found on one of the functional Facebook threads, a cardiologist in Los Angeles who is a totally functional cardiologist, and he was posting all about, the healthy fats and the need for that. So, it's changing, and people are telling each other about this. I found the units. It is milligrams per deciliter.
Oh, perfect. Okay, yes, we work in that up here too. Okay, so they are using the metric measurements. Terrific. Thank you. So I've just been listening. Thank you so much for this information. And I wanted to ask if you could explain to us another factor that is absolutely critical to feeding every cell in the body. You touched on it earlier, and that was the endocrine system, our hormonal system, and how the hormone affects brain health.
Yeah, that's a great thing, because there's so many levels and areas to cover of ways we can support the brain healing. But hormones are some of the easiest ways that we can support our brain. And we know now from studying women going through menopause and after menopause that the moment a woman starts losing her estrogen, her neurons are degenerating. So we have receptors in our brain. Brain is full of receptors for estrogen, for progesterone, for testosterone, for pregnenolone. So all of these hormones, and they're in both genders, more estrogen and less testosterone in women, and the other way for men, but we have them all, and we all need them all. And we need them even to be in a balance with each other. So, you just support your estrogen and your testosterones in the toilet, your three-legged stool is going to still be wobbly. So all of these hormones work in conjunction. And so I think that it's so important to ask your doctor to test all of these hormones. And if they're, low, even if they're in the normal range, but they're at the bottom of the range, is that where you want to be? They're pretty big ranges in hormones. And
yes.
The thinking is somehow they decline with age. So when we look at a testosterone level, we say, okay, the top level is an 18-year-old man and the bottom level is an 85-year-old man. But, people need their hormones at any age. And so, this notion that you're old and you don't need your hormones is another one of the medical dogmas that challenging. I can work with people that have, say, a woman that's been off her hormones for 20 years that comes in with cognitive decline, and I can put her on hormones, and I mean, within days, you can see improvement in the cognition.
Yes. I'm sorry, finish that, please.
Well, I was going to say also, when I was doing clinical trials, 2 different times in my trials, women were taken off of their hormone replacement. And at that time, I was a psychiatrist. I didn't work with hormones. I didn't know much about them, but I knew enough that they would come in the next month and say, this was a really bad month. My memory's so much worse. I could see it in speaking with them. I would do the neuropsych testing that we did every month, and I would see that they had sharply declined. And I said, please go back to your doctor and tell them you need to be on your hormones. The doctors had said, oh, you're way past menopause, you're demented, you don't need these anymore. But clearly they needed them. So that was the first thing that opened my eyes to hormones. But now we have scores and scores of data and studies, that show us these things. There was a fascinating study that a Stanford psychiatrist, Natalie Razgon, did a couple years ago, and they took women that had been on hormone replacement, and they randomized them either to stay on it or stop it. And they followed those women for 2 years, and at the end of 2 years, they did head scans and they did neuropsych testing, and they showed that 100% of the women who had stopped their hormones had degeneration, and they could see that on a head scan. And when you see degeneration on a head scan, it's more than mild.
Yes, of course it is. That's both fascinating and also for me very, very traumatizing, because I look at the number of women who are put on as teenagers birth control pills to alter hormones, and then on the other end, women who are having issues with their reproductive organs and perhaps tremendous bleeding, and they perform a full hysterectomy without any consideration for hormone levels, and they fall apart. These women absolutely fall apart. Yes. And then they're put on SSRIs.
Exactly. When I try to put a woman on Medicare on hormone replacement, I get rejected and told they're covered, but I could give them antidepressants.
Isn't that something? Oh my gosh.
It's really something. And it's so really the notion that these hormones are trophic for the brain, that they just provide the basic support for our brain to work, is critical. We have lovely data with pregnenolone. For some reason, pregnenolone is available as a supplement and not a prescription, though I would always advocate, knowing your level if you're going to start it. And then, we don't want to overshoot things with hormones. We want the right amount. There's a sweet spot. And so you don't want to overdrive any one of your hormones. But I did a full day training maybe about 6 or 8 weeks ago with Dr. Mark Gordon. He's a traumatic brain injury expert, and basically what he taught us was the whole day was hormones.
Oh,
and
wow.
He works with, veterans that have had, explosive devices and horrible head trauma, that, have had a personality change, or suddenly beating their wives, or they're psychotic and they're on all kinds of psychiatric meds, and he can restore their functioning. And
amazing.
And he can get them off of all of their medications. And obviously, we probably didn't hear about his failures, but we heard about many, many of his successes. And the way that he does that is hormones. And he checks every single possible hormone, and he gets them all in balance. He puts the levels up near the top of the range. And that, it dovetails perfectly with, what I do with my patients with dementia and functional issues. And just the most amazing stories. So what I believe is, when you give the brain the nutrients that it needs, you're going to help to promote the healing there. So hormones become very easy. It's not a hard thing, to do, if you can find a physician that will buy into that notion.
There's the key.
That's right? The harder part.
Yes. I was just, it's like pulling teeth for me in Canada to get, as apparently a middle-aged woman, to get my doctor to run a hormone profile. And now that, of course, the next question I get is, are you planning on becoming pregnant? And I look and no, of course not. But they just think it's absolutely peculiar that I want to know where my hormone ranges are.
Right. At this point, I'm a big advocate for knowing that at every stage of your life. I work with young people in their 20s with no hormones. I have young men in their 20s that are needing to be treated with testosterone or with Clomid, because things have disrupted the HPA axis of the brain. So maybe this can segue into a couple other notions of things that affect the brain. So infections affect the brain, and we're having an epidemic of Lyme disease and the co-infections. And finally, our CDC is recognizing and starting to track more effectively the spread of what's happening with this disease right now. But, people think of Lyme and arthritis, and the bigger part is the effects of Lyme in the brain. It's a spirochete, just like syphilis. And we know that syphilis, a man has an STD, and then, decades later, he's quite demented and raving mad.
No kidding. Oh my gosh.
Lyme is a spirochete, just like syphilis. And so for some people, it has a predilection for the joints, but at least half of the people, it has a predilection for the brain. And so we see a lot of neurocognitive problems, a lot of emotional problems, psychiatric problems with that. But basically, those problems, as I mentioned earlier on, when we're seeing these kind of problems, it's not a neurotransmitter deficiency per se. It's caused by disruption of the HPA axis from the inflammation that's happening there. So when there's inflammation, then the hypothalamus doesn't send the right signals to the pituitary, and then the pituitary doesn't send the right signals to our sex organs and our thyroid to make the right amounts of hormones. So when I see a young man, with no testosterone, I'm looking for infections, and the other thing I'm looking for is toxins. So toxins, environmental toxins, is another factor that can, greatly affect the brain. And
so are you saying that the new car smell is detrimental to our mental
yes.
brain function?
Well, that's exactly right.
Yes. You'd save a lot of money and get a better deal and more health by buying a year-old car.
Yes, isn't that...
I really like that you're bringing up the hormones for the brain. Actually, my somebody on the Feed a Brain team who is doing a healthy hormone protocol of sorts, and I was doing a brain protocol, and we're pretty much doing the same thing. we got looking at it. It's these all help everything, and we all know hormones definitely affect mood. Even as a male, I know that they affect mood a lot. And so the hormone replacement is great. But then what do you think about replacement versus rehabilitating?
That's a great question. And so, the goal of a functional medicine approach is to find the root causes of why someone is sick and fix those, repair them, put them into balance, restore them so that you don't need to take medications. And
the hormones would be considered a medication that you're taking, the replacement hormones.
There's yes, but there's two groups there. So for my young people, I was working on a case last night and looking at all his patterns and what was happening, and trying to determine why is his testosterone low. It's a 31-year-old guy who is in perfect. He's a perfect patient. Eats a beautiful diet, exercises, meditates. He's doing saunas for 4 hours a week because we discovered high levels of toxins. But in his case, it looks like he's got some Lyme disease. He's got some high levels of chemical toxins. He was a semi-pro tennis player and, the captain of his tennis team in a Division I college. And so he logged in thousands of hours on the tennis court where, there's all those plasticizers and things in the courts. And now we know that those sports courts are a problem with toxins. So he turned out to have two things that I've discovered: a high level of toxins, and it looks like he clearly has had Lyme disease, and it looks like he still has some Lyme disease. So he's not, there's a gradation of Lyme disease and how sick people get. And, he's like Lyme disease with little letters, not in capital letters. He's pretty healthy guy overall, but there's some things that are suffering for him. And certainly there's no testosterone. So I told him we will do things to bring up the testosterone with the goal that we're going to clear these toxins and infections so that then we can take you off of the testosterone.
Okay.
So let's give him some Band-Aid symptom relief so he can feel better, because hormones are feel-good. They're feel-good chemicals. They make us feel good. We're depressed without our hormones. I've cured some horrific depressions just with hormones, and not with medication. I had one patient, you mentioned the testosterone and the mood, and it was an elderly man that came in with a severe depression, and I thought, oh goodness, he's going to be demented, because a lay life depression makes us worry about dementia. But no, he was not demented. He was sharp as a tack. But he had severe insomnia and suicidal thoughts, and they put him on one antidepressant and they got him sleeping, and they put him on a second antidepressant and they got rid of the suicide. But he sat in a chair for 2 years. He didn't want to go anywhere. He didn't want to see anything. He just sat in a chair. And so I tested everything, and I always tell my patients it's never just one thing. It's always multiple things. But in his case, he was an exception to that rule. It was one thing only that really stood out, and it was that he had no testosterone. We got him started on the testosterone, and within a month, he got out of that chair and he went back to work. And this man
Nice.
was in his late 70s. He was a brilliant man on his third career, got back out of that chair and resumed a very productive life. And
Isn't that amazing?
I advised him that he could slowly taper one of the antidepressants, wait 6 months, and if everything was good, taper the other. His psychiatrist called me and said, Kat, have you gone over to the dark side? How could you take this man off his antidepressants? Do you know how depressed he was? And I said, yes, I do. And now we found the reason, and we fixed that reason. So, you know, why does he still need these drugs that have other consequences? So yes, the hormones are exciting.
Oh, Kat, I thank you for helping to heal that man. I just, the potential is tremendous, especially considering the influence of xeno hormones, environmental hormones, as well as prescribed hormones. And yes, your comment about toxins and infections, I think we need to, Kevin, I think we need to have a whole other episode on that, because I have a question. If, you know, I wonder the exposure some of these professional athletes get to their turf. Thinking of, well, all the turfs, you know, all the major sports leagues have manicured or artificial turf, and that does not come naturally.
Right.
You know, just little things like that. We want things around us, our environment around us, to be pretty, whether it's inside the house or outside the house. And that all comes at a cost. And I think there's a whole other episode here, Kevin.
Well, you know, it strikes me that with the athletes with the you know, repetitive stress injury and the chronic traumatic encephalopathy, you know, as I mentioned earlier, that head trauma can be minor, but if the environment that is sustaining that head trauma, i.e. your body, is not healthy, you know, it's going to have a bigger consequence. And so that's such an interesting thought, Michelle, that we have these people spending, you know, hundreds and thousands, there's probably thousands of hours that they're spending on these sports turf, you know, and they're you know, rolling around on the ground and smelling and touching. These chemicals are getting all over their body. So it would be interesting for somebody to look at those professional athletes and measure their toxin levels. And so one could possibly, if you already have a very high level of toxins that, you know, that are definitely known to affect the brain, that then a more minor head trauma could cause a bigger effect.
But then at least they are getting exercise and a lot, which there are numerous studies showing how neuroprotective exercise is for the brain. Like, what we really need to worry about is the sedentary people who are being exposed to loads of toxins.
Yeah.
I'm not saying we don't need to worry about the football players and whatnot, but yeah. I am so glad you joined us on this episode, Kat. This is fantastic. There's a few things. Go ahead, Michelle.
Well, I just don't think I've sat here at my desk in awe and said, wow, so many times.
And then it was like, we need to do more and more and more of these.
Well,
and I think we're definitely going to need to have you back on several times. There's a few things I want to do to make sure we did. The meta-analysis on cholesterol from the World Health Organization. Yeah. Could you send me that? I want to put that in the show notes.
Sure.
And then I wanted to ask you, what does Dr. Toups recommend that we do right now, today, to improve our brain health and to aid our brain injury recovery?
Yeah. I'm going to start with what you just said, which is exercise, and what we've also said, diet. You know, the diet, of course, sets the whole tone for everything, but, you know, daily exercise and some kind of daily meditative or mindfulness practice, the best data we have for changing our brain is exercise and meditation. And it's free. You don't need money to do those things.
Yes,
You
yes.
just need a little bit of time. And with the meditation mindfulness, you don't need to sit in an uncomfortable, lotus position for 30 minutes. You can do little sound bites. You can listen to guided meditations for 5 minutes a couple times a day. There's a lot of nice apps for guided meditations. And mindfulness is any time that we shut off all that chatter in our brain and just come into our body and just, sit there with our body. You can do it while you're washing the dishes. So, 5 minutes here and there during the day. Those things, it's very clear that helps us to start creating new neurons. And one other really easy thing to do, because let's keep it easy, there's enough difficult things to do.
Yes.
Things differently every day. If you put on your right shoe first, put on your left shoe first. Try brushing your teeth with the other hand.
Fabulous.
Thinking things in a different way. If you're doing your exercise and you're rolling over into the next position, roll over the other direction. Every time we do things differently, we will create new neuronal connections in our brain. And so that's really what it's about.
Dr. Toups, Kat, thank you so much for...
I have a million more things to tell you, but...
I want to hear each and every one of them. And yes, let us please...
I vote repeat guest all the way.
I think it's a hands down.
Yeah.
And I got some exciting information that I just this past weekend that I incorporated in the talk I gave Monday night to functional medicine doctors from Dr. Vajjani from Cyrix Labs.
Yes.
And some of the immune components with the brain. I mean, we already recognize that a lot of the stuff that's happening in the brain with neurodegenerative disorders has an immune component, but he linked it to specific foods, toxins, and pathogens.
Wow. Yes. Wow.
And so it's, and basically there are certain things that will cross-react with amyloid antibodies. And anytime you have any trauma in your brain, amyloid is secreted in response to that trauma as a protective mechanism. So
and just briefly explain to our audience what amyloid is, please.
Right. So there's the whole amyloid hypothesis about Alzheimer's dementia. Because one of the two hallmarks in Alzheimer's is that you develop amyloid plaques in your brain. And amyloid is this gummy, sticky substance, so it starts to gum up the works, and you develop neurofibrillary tangles of tau beta protein. So that's the definition of Alzheimer's. They see that on autopsy. But some people on autopsy have those things, and they didn't have dementia. But the general thinking in Alzheimer's is, okay, it's the amyloid that's the problem. Let's wipe out the amyloid.
Right.
Dementia. Well, I did
kind of like cholesterol, huh?
Yes, exactly. We have to respect that our bodies do things to protect us and help us, and if we start disrupting all those things with blockers, that's where we get into trouble. So I did studies where we could wipe out all the amyloid in people's brains. We could see it on the imaging, but they did not get better. That is not the problem. The problem is something that started before the amyloid. The amyloid gets secreted in response to a problem that is entering your brain, and that's generally inflammation, toxins, infections. But the interesting thing with the amyloid is Dr. Vajjani then made a monoclonal antibody to amyloid, and then he wanted to see what cross-reacts with the amyloid. So if you have an antibody, if you have substances that are you already have the amyloid in your brain, and if you have specific substances that react to it, then you're going to really have an inflammation, i.e. more autoimmune problem happening. And so what he found was he tested 180 foods, and he found 8 foods cross-reacted with amyloid. He tested a bunch of toxins, and he found in the toxins that aluminum, phthalates, and plasticizers, like those sports courts, reacted with amyloid in the brain, and then a host of pathogens, which seems pretty obvious, but the Borrelia from the Lyme, the herpes virus, Epstein-Barr virus, West Nile virus, if you have those things and you have a breach of your blood-brain barrier, then the antibodies that are in the blood will cross the blood-brain barrier, and they will interact anywhere you have the amyloid deposition, which will worsen your brain degeneration. So there's so many different layers to come out at these pictures.
I know.
I suggest we create a cliffhanger here, and we just put a to be continued on the bottom of this podcast, because I mean, we are now diving into upstream medicine, and Kat, this is brilliant, and I feel so honored that you are sharing this cutting edge medical research with us. It is profound and will affect so many lives. I can't wait until it is more available. You can bet my doctor is going to get a link to this podcast.
Well, yeah. I'll have to, when it is available to me, they recorded the talk that I gave for the doctors a couple nights ago, and perhaps your doctor will some of that.
Yes, I have to say, he was very humble, and he said, Michelle, it surprises me that I am the one learning from the patient, and he's actually committed to taking the IFM program because of the influence I've had on him over the last 2 years.
That's so excellent. I learned so much from my patients. I mean, there's so much to learn, and we have to keep our minds open, and, patients bring in the most interesting ideas and research, and it's why I have 200 windows open on my computer at all times.
you as well. Okay, I'm going to put a big to be continued stamp on this podcast, and Dr. Toups, I do hope you will join us once again. There is clearly, we need to sift through Pandora's box. So please.
Thank you so much for having me, and looking at the amazing work that you two are doing. And it's so great when we can, come through our own journeys and use our passion for helping other people to recover, hopefully more quickly than we did, because we're really learning these things. And
yes, that's exactly it. Yes, and I do hope, and Kevin's really pushing ahead, and we were told not too long ago, it's going to be the patients who are going to turn healthcare around. And
absolutely.
Yes, and actually I was at my local medical center. The university there hosts a journal club, Humanities in Healthcare Journal Club, and I get there as often as I can. And so there is a small core that is starting to take a look elsewhere. So I'm gently, every opportunity I have is gently introducing, functional medicine, and just think about it from another perspective, and take a look at those lab ranges, and why is it that the patient is exhibiting these symptoms? And it's, I think, yes, it's slowly as patients come in so well researched with your work and the podcasts you're doing and the webinars that you do, this is going to start to change, and I'm so grateful to be on the path with you. Thank you yet again.
Well, thanks for sharing it with me. Wonderful to know you guys and see all the wonderful things you're doing to bring this message to people. I'm going to definitely share your resources with my patients as well.
Thank you very much.
Thank you so much.
We wish you a wonderful afternoon, and we will speak again very soon.
Okay, that's wonderful. Okay, thank you guys.
Bye-bye.
Bye.
Wow, Kevin, let's summarize that in one word: inflammation. Inflammation continues to burn other areas of the brain. Don't we talk a lot about that when we talk about food?
Yeah, inflammation. Inflammation is not the source. The source of inflammation is the source, but inflammation definitely triggers a lot. And as Kat talked about, when you trigger an inflammation cascade in the brain, there's no off switch. So it's very difficult. And that's what we need to do. We need to correct our biochemistry and our neurochemistry. And what a fantastic interview.
Well,
thank you so much for introducing me to her work.
Honestly, I just, she's, I really like her a whole lot. And her work is just the cat's meow, I guess. I could say, I mean, I just find it so inspiring. And, to think that we have a physician in the Bay Area who is looking at mild cognitive disorders as TBIs, considering the effects of toxins, infections, and considering also how to settle these metabolic influences to, as you say, bring everything back into balance. The last thing we want is a brain injury to become chronic degeneration.
True story. Yeah.
Yeah. So
and it's very possible and common. I mean, it's a delicate little organ up there.
it is.
Yep.
Well, and I really like how Dr. Toups is just weaving so much in this cardiovascular disease with infectious and causing psychiatric diseases. I mean, there's so much overlap and so much breadth, and to have someone with all of that experience bring that together to her practice, to her lectures. I'm excited. I'm so excited about what's to come.
Mm-hmm. Well, thank you guys for being here and listening in again.
Yes.
Head over to feedabrain.com/VIP in order to get the deal I spoke of earlier for $49.
Fabulous. You don't need any other gifts. There you go. Gift of improving your brain function. Priceless. Yeah, terrific. Well done. Thank you again, Kevin. It's been a blast.
It has. Thank you.
All right. Have a great day. Bye.
Take me to a doctor, just take away this curse.